I'm going to try and share a few slides so I can summarize what we have learned so far. So in summary, the two talks that we heard, the three talks we heard today regarding pre-op assessment, intra-op care, and post-op care and monitoring. It is important to provide adequate analgesia, narcosis, and relaxation with appropriate monitoring. That is, before that, good preoperative evaluation and care is key to avoiding cancellations and complications during surgery. We can see the amount that is lost. We lose millions because of inadequate preoperative evaluation and preparation. So it is important that each of the departments, each trust plans this well. They invest in good preoperative assessment. A new term, preliminary scanning, was introduced today in the discussion. This is done very early on, probably at the time when the surgeon looks at the patient and decides on surgery. That is probably the time when we should scan them as early as possible, so we can pick up any problems that might be, so that these patients can then be dealt with. Either they can go for surgery, or they can be optimized, or they can be treated in a special for some special conditions, so that they're ready for surgery, minimizing cancellations. This also means that if these patients have had a preliminary scanning, they may not actually require a full-fledged pre-assessment, and we can also decide whether they can be done at a peripheral site where there are no HDO, ICU available, or should they be done in the main hospitals. So, and also following them up, calling them up after a date is given, say with a phone call every 3 months, to see how they are progressing. Do they still need the surgery? Has anything changed? Maybe they need the surgery sooner than planned. So this kind of a follow-up would make a difference. And from what I understand, these changes will be introduced from the 1st of April. Risk assessment is a basic part of good clinical care, said Professor Munasinghe. It is not a single event, but a continuous process that requires continuous reassessment and follow-up. We have to discuss risks with the patient and the team. And finally, we have to use our clinical judgment when it comes to delivering care. When we heard from Andrew Kane, we talked about providing good monitoring, adequate analgesia, narcosis, relaxation with appropriate monitoring all these important aspects, the triad of anesthesia. Monitor and maintain physiological parameters to ensure good outcome, which means maintaining good mean arterial pressures so they do not end up with acute kidney injury. And also, we heard from Frederick that postoperatively, monitoring patients in the postoperative phase can ensure not only a good patient outcome, but can have significant cost benefits. New equipment are evolving that can make this process more effective and efficient. Not acting on early warning scores can have serious outcomes for patients. So all these are the learning points.